Hi YouTube, this is my second video. I have a lot of news to share and I'm excited. I have my surgery scheduled for, I think it's 7 more days. And tomorrow will be 7 days. It's next Friday, the 29th of March, 2013. I was going between whether or not I would get the lap band or the sleeve. For the longest time, I only considered the lap band. Because I just automatically thought, oh, it's safer. Then I've been on the forums, I've read a lot of things, I've looked at a lot of studies, and now I ended up switching. I've decided that the sleeve is best for me. I don't think that there's necessarily anything wrong with the lap band, but there are a lot of reasons why I chose not to, and I'm going to go over those. I just first want to say that if I had insurance that was covering this surgery, I would probably select the lap band only because I'm not as scared now, but I do feel like it's less risky, and studies show that it's a little bit less risky at the time of surgery. And I'm sure I'm probably going to have people telling me, oh, this and that, and that I'm wrong, but all of us only know what we read and what we study, and from what I've read and what I've studied and what I've talked to my doctor about, this is what I know. So if you're gonna rebut what I say, you don't have to be rude to me, please. So what I have learned and seen in the forums, which I know you're gonna see good and bad, and you may see more bad because people are having problems, and so they come there to get answers and to see who else's maybe experiences problems, and I do understand that. I definitely took that into consideration, but I can just say that in the couple of months that I've been on the lap band forums, there's obviously a lot of successful people with the lap band, but it just seems like over time there are complications, and if I had the lap band surgery and I had complications, I had a band slippage or whatever, a leak, whatever it may be, and my insurance were to cover the repair, then I don't think it would be that big of a deal. I mean, it wouldn't be fun, and it'd be a time in my life that I would probably want to forget later on, but it would be worth it to lose the weight and to be healthy. But the problem is, since I am a self-pay, I would end up paying for those surgeries, and I don't know that I could pay for those surgeries. So I see people in there that are having the problem of the fact that they want the band out, but they can't pay for it, and the insurance refuses to pay for it. And I don't want to be in that situation. I don't want to be miserable. So that's one reason. That's just one. Another one would be that I get almost every year, I end up getting a very severe cough, and they call it like bronchial asthma, and it's triggered by allergies. And we do everything we can. I've done everything I can. Nothing stops it. Steroids will help, but it just never stops. And it's a very rough cough. I don't know how to explain it. And it just shakes my insides. I feel it. And so I was thinking more and more about that. I was thinking that could very well disturb the band, I thought. So I talked to my doctor about it, and he did say that it could very well do that if it's that rough of a cough and that often. I mean, when I went go in for chest x-rays, my lungs would just be, I don't know what they called it. It's not bruised, but they could see that I had been coughing. So anyways, I just definitely feel like if overeating and things like that push on the band and can cause it to slip, then other pressures could very well cause the same slippage, and so I don't want to take that risk either. See, I have trying to think of what else. The other thing is I have over 200 pounds to lose, and it's been shown in studies that people with the sleeve lose more than with the band long term. And keep it off long term. And I know that we all are in control of our habits and our bodies, but I got this size, and the band or the sleeve is only a tool, and I can't say that I might need I feel like I need the most help I can get, and if the sleeve is the answer for that, then that's what I'm going to choose. The only thing, I started studying the sleeve, I just freaked out from the beginning because I was like, oh, I don't want to cut my stomach out, that's so permanent. So anyways, when I started seeing all the complications that you could occur with the band, I started studying and looking at the sleeve. And so basically there's a little bit more risk during surgery for the sleeve, and I guess right after surgery, obviously, because they're cutting your stomach, bleeding, infection, I don't know, I mean, I do know, but there's different things. There's complications with every surgery, and there is a little bit more complication than the lap band, but it's not much. And what I also found is that in the long run, the studies that I've read compared to the lap band, that the sleeve long term has less complications. And that's what I was seeing. Looking at both forums, I went to the sleeve forum too, along with the studies, and talking to the doctors. Three doctors had the same opinion, that there are more complications with the band. They may be what are considered minor, like getting stuck, things like that, which I guess can happen with the sleeve, but it just doesn't happen as often. But even the minor complications can be life-altering. I don't want to be miserable. I want to be healthy. I want it to let me know when I eat something wrong, but not every day, and if I'm eating correctly, I don't want to have to go through all that. And I may experience that with the sleeve, but it just seems like it's more and more with the lap band. And then another reason would be, sorry, thinking, I'm tired. With the band, the band and the sleeve both have the chance of leaking, and what my doctor explained to me is that they leak in the same area up there at the top where the esophagus and the stomach meet, and it's narrowing. I'm sure there's better explanation for that, but where it narrows, that's where the pressure is going to build, and that's where it's going to leak. And he explained to me that most of the patients that have the leaks with the vertical sleeve are patients that have revised or had a revision from the band because they have scar tissue there. So it lowers the risk for us that have not had that revision when they calculate those risks or whatever. I don't know if that's making any sense, but obviously these are all my opinions and views, and I'm just sharing them, so maybe even if I just feel like we should look at both options. And so if you're thinking about getting surgery, I just encourage you to look up information on both and study on both, ask your doctor about both, and see what's the best fit for you. Maybe the band. If I had insurance, I may still go with a band, but I don't, and I can't afford another surgery. My doctor did say that if there were complications like a leak or something like that, that he would not charge me, but I would have to pay the hospital fee, and that's what I'll have to do if I have a leak. Just pray that I don't, and just remember that it's a small percentage. So it just seems like there's just fewer complications with the sleeve that can happen. And as far as deficiencies, some people are reporting vitamin deficiencies, but as long as they're taking their vitamins, then they're good, but the majority do not. And then I think about some people are deficient in some things anyways, probably before surgery. I'm not, so I'll know if I have the surgery and I'm deficient, I'll know it's from not taking in enough. So, and that's what I was going to say, is that it's not from rerouting the bowels or anything with the sleeve, it's just from solely not getting in enough nutrition, because we are weight loss surgery patients and we take in very little. Could be wrong about that, but that's the way I'm viewing it. Like I said, I'm in the beginning of this journey, so I don't know everything. None of us do, but I definitely don't. I guess that's it for that. I worked, like I said, I am self-pay, and I worked it out to where we're a one-income family, and I was able to work it out to where the payment is really only $80 extra a month for us from our regular bills. And what I did was I got a credit union loan to cover the surgery, and it covered a little bit more than the surgery, but not enough to consolidate my car loan. I wanted to pay off my car. So what I did is I also applied for Care Credit. I was only able to get $3,500 through them, but it was enough to use with the other bit that we had from the credit union loan left over after paying the surgery to almost pay off the car, but at least to pay it where we only have like 8 months left on it, but we don't have to pay on those 8 months for over a year, which means and also pay off our credit cards, which we had like $1,500 owed to credit cards. So I consolidated our credit card payments and my car payment. We won't have, and the car payment and the loan from the credit union are the same amount. So basically it's like I still have the same bills, but it paid off the car and it's paying for my surgery. The extra 80 is the Care Credit. I extended it out for 60 months. So what's that, 5 years? So we are in more debt, of course, but our monthly bills, actually that's not even right. It's not even $80 extra, because you got to take into account how much we were paying on our credit cards also. So really, I have to look at it again. We're coming out with more money per month, even though I'm adding this surgery to our bills, which I give all the glory to God on that, because I had to think about it. I wanted to consolidate, but I couldn't because I couldn't get enough. But then I was like, Care Credit, try for another loan. Anyways, I'm excited about that because I was really worried. I was thinking I was going to have to go out and get a job immediately to pay for the surgery, which I was going to do because I have to do something. So that's kind of a background on my choice, my decision. Just wanted to share it, and hopefully it helps someone. I'm sure it'll anger some, but just be nice. And I am going to make another video about my liquid diet, which I'm currently on, but I know this is really long, so I'm just going to stop. Alright, YouTube.